And I'm really excited to be joined today by Elizabeth Schwemlein, who has been an instrumental leader in making this work a reality across Colorado. Liz is the program administrator at the Colorado Behavioral Health Administration and has led this initiative in its earliest stages, from policy to on-the-ground implementation. She's worked side by side with our team, Colorado schools, and community partners to ensure that mental health screening is a meaningful part of how schools care for students every day. So Liz, thank you so much for joining us and for your incredible leadership. I'd love to start out by asking you to share what's made this work so powerful in Colorado and why you see school-wide screening as such an urgent priority.
Of course, thank you. I'm excited to be here. Excited to be talking about this important work. Mental health screening school-wide is important for all youth. Early identification and intervention of mental health needs improves outcomes for students. It's proactive and preventative, and it's a process that really helps to normalize discussions about mental health and reduce stigma, and it provides resources and support to young people and their families. Positive mental health and well-being has been associated with student readiness to learn and academic and lifelong success. It's a super important part in my view as how we're able to educate and support the whole child within an educational setting. As far as Colorado specifically, we have a survey that goes out every other year. It's called the Healthy Kids Colorado Survey. It goes out to all middle and high school students in schools that elect to participate. It's Colorado's most comprehensive data source for understanding how our youth are doing. It had about 100,000 participants last year, or in 2023, which was the last year it was implemented. And that survey indicated that in Colorado, 42% of high school youth believe that their stress levels are unmanageable. 17% of middle school students had seriously considered suicide. 26% of high school youth reported persistent feelings of sadness. In addition, unfortunately, suicide continues to be one of the leading causes of death for our youth in Colorado. So all of this indicates that we really do need to provide behavioral health support. And this need combined with Colorado's kind of unique limited access to mental health care, particularly for youth and families in our rural and frontier areas, makes it really crucial for schools to be a part of the process in identifying needs and working with families to connect them with necessary mental health resources. Many schools themselves, unfortunately in Colorado, probably also nationwide, are very under-resourced with both workforce and finances to be able to provide a comprehensive mental health screening program. And that's what makes it so important to be able to provide some of these legislatively or grassroots movements to give them access to a screening program like this that includes technical assistance and support with implementation and intervention.
Thank you, Liz. I appreciate how you highlighted what's driving the work. The statistics are just so sad when you look at everything else that's happening and how that can really impact academic success. So we didn't really bring that piece in today, but there's a lot of research around looking at and identifying mental health and how that really is a driver to increase attendance and increase test scores and all of that sort of thing. So decrease disciplinary referrals. So that's an important connection that we didn't talk about earlier.